Hello guys, my name is Abdominal Ali and I'm second medical student in UV Gullas College of Medicine. So today we are going to do physical examination on the abdomen region, and we will going to do with Mr. Hassan. He is 12 years old, so he's participating with us today to do this procedure. Okay, first of all we will educate the patient what we are going to do, and then we will let him in this position, in supine position, and put his arms in his sides. Of course we will maintain the privacy and the hygiene, and our hands must be quite like warm to be more appropriate. So first of all we were gonna do basically 4 steps, which will be the an inspection, and then we will do the auscultation, and then we're going to do the percussion, and finally we'll do the palpation, which is the last part. So now let's begin with the inspection. As you see, we will expose his abdomen like this, and then we will see for if there's any abnormalities like his skin color, and we will going to see if there's any scars, any previously surgeries, and then we will see if there's any vascular abnormalities like caput medusae and then etc. So after we've done this, of course we will observe all the 4 quadrants of the abdomen. So obviously I'm not expecting anything here. It's all clear. It's all normal findings. So now let's jump into the second step, which is auscultation. So I'm going to use the stethoscope, okay? But here we have to clarify one thing. The auscultation must be before the percussion and the palpation, because the percussion and the palpation may elicit normal bowel movements, okay? So keep this in your brain, okay? So now we are going to auscultate all the 4 quadrants for 2 minutes. Okay, so now we are expecting a bowel sound every 5 to 15 seconds. So that's what we're expecting here, okay? And another thing that we have to auscultate for the brutes, if there's any abnormalities on the aorta, any stenosis on the renal vessels, like here in the middle. Here we can auscultate for the aorta. It's normal, and here we're going to auscultate the renal or the renal veins and arteries. Okay, so now we're done with the auscultation part. Now we will move on to the percussion. Okay, for the percussion, we are going to use our middle finger right here. With the right hand, with the other hand, we are going to tap in, and we can recognize the sound. If it's dullness, if there's any dullness or tympanic. So we're going to start for all 4 quadrants, like this. Okay, as you know, there's 2 sounds. The tympani, which is air-filled sounds, and the dullness, which is the solid parts, the organs. So as we see here, I can recognize here like a little bit of dullness, here a tympani, little bit of dullness, and so on and so forth. So I'm going to do a little technique which we can appreciate the ascites if there's a fluid in his abdomen. So we will put our hands here in the midline, and then we will see like this. We'll do like this, and we'll see if there's any waves, which obviously it's normal right now. Okay, so there's a technique that we can for the ascites, we can exactly know if there's ascites or not by the shifting of the dullness and tympani. So we will ask the patient to be in this side. To be in this side, okay. So the fluids will go down and the air is coming up. So we will feel here the tympani, which tells us there's a fluid. And from here, it's going to be a dull because all the fluids will come down. I hope that was clear for you. Okay, now we are going to do to measure the size of the liver, okay, which we can use two techniques actually. First of all, we're going to use this technique, what I was doing in a moment. I will start from the upper side of the chest. Now I can feel a resonant sound. Resonance. Dullness. 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 Here I'm feeling a little bit of tympani. So we are expecting a size of 6 to 12 centimeters of the liver. So if it's larger than that, so we can appreciate the hepatomegaly. Okay, so now we are going to do another technique to measure the size of the spleen. So I will put my hand down and other one here. It's quite difficult to recognize the size of the spleen unless it's their splenomegaly. Okay. So I'm not feeling any there's no any large size of the splenomegaly. Okay, so now what we are going to do is the second part of the measuring the size of the liver. We are going to put the stethoscope on the external side, and then we will scratch like this from the mid-clavicular side. We're going to scratch like this. Here, right there, I can feel the tip of the bridge of the lower part of the liver, and the same procedure from up side. Okay, right here, I can feel it in this, which is normal. Okay, and same thing with the splenomegaly or the spleen, but it will gonna be quite difficult. Okay, so now we are going to move to the palpation. Okay, first of all, when we are doing the palpation, we are going to watch the patient's face, and we are going to talk to him to let him a little bit focus with us, because we will not let him to control his whole abdomen while I'm palpating. So now, first of all, I will do a superficial palpate. I will see if there's any muscle tone, which obviously there's no. Okay, and then I will palpate all the 4 quadrants. Okay, there's a technique which we call the rebound tender. Like we will do like this, and then suddenly I will release the pressure. If we appreciate any pain, so there's abnormalities in his abdomen, like this. This is what we call the rebound tenderness. Okay, so now we are going. Okay, so now we will going to examine if there's any abnormalities or pain on his kidneys. So we will let him in this position, and we will see. So obviously there's no any pain, and then another thing that we can do is the both sides. We will do like this. Same at the other side. We are examining if there's any large kidney on this side. Now we were going to start with the signs. So basically we have four main signs. I will start with the Morphy signs, which we can appreciate the cholecystitis. The cholecystitis is there's abnormalities on the gallbladder. So we will going to ask the patient. First of all, we will come like this. We will push in the last rib, below the last rib. We push like this, and then we ask the patient to take a breath, inspiration. So there's no any pain. If there's a pain, then that's going to tell us simply there's a cholecystitis. Okay, the other sign is for the appendicitis. First of all, there's a McBurney point, which is from the anterior superior iliac sac, okay, and the umbilical region. So it's gonna be the 2/3 right here. So right here is the appendix. So first of all, we're going to push, palpate it. There's no pain. The second thing, there's the Rofinks sign. The Rofinks sign means that we are going to push the other side of the appendix, and then suddenly we will release it. So the pain will elicit here. So that will tell us there's appendicitis. And there's another two remaining signs for the appendicitis, which is the obturator and the Psoas. So let's begin with the Psoas, which is a muscle in the back of the abdominal wall. It lies right behind the appendicitis, the appendix. Okay, turn around. Okay, so what we'll do is we will flex his hip like this, straight forward. Okay, like this. So if there is a pain, if there's appendicitis, he will appreciate a pain. The other sign is the obturator, which is a muscle. It also can tell us if there's appendicitis. We will do like this, and we will rotate his leg interiorly like this. Okay, so now there's no any pain. Okay, now I think that I'm done with everything with the concerning the physical examination of the abdomen. So now we will go into write the report, and you write the findings, and that's all. Thank you for listening to me. Thank you for watching this. Goodbye.